and hospitalizations. We're testing at unprecedented levels. We have data to share with you today that is staggering at one level and really calls on all of us to do what we can individually to wear a mask when we're in public, to get vaccinated. If we're not, get boosted. If you haven't received your booster shot, we had a White House call this morning with governors across the nation, and each of the governors in each of the states are experiencing the same kind of run-up in surge in COVID-19 cases really across the country. The majority of those cases in other states are with the Omicron virus. I think we're still seeing about half Delta and half Omicron. We'll hear from Dr. Rattay about that a little later. I am joined once again today by our team that's been with us for months now, and AJ Shaw, the director of the Delaware Emergency Management Agency, and Dr. Rattay, the director of the Division of Public Health, and Pam, our sign language expert for the deaf and hard of hearing. Thanks for joining us today. We appreciate the update we're going to provide to Delawareans with our response to COVID-19. So let's go right to the data. You can see the number of cases on a 7-day moving average, now 25, over 25, almost 2,600 cases. That's significantly higher than it's been in most of the time through the pandemic. And it is in part a function of testing. We are testing at, again, levels beyond what we're doing just several weeks ago and over the last several months, but also a function of the positivity rates in the tests that are being administered. Essentially, 1 in 4 people tested are testing positive for COVID-19. The data that indicator that I look at the most, as you know, is our hospitalization number, which has ticked over 600. The peak of the previous high point was back in last January the 14th at 474. So we're 25%, 27% higher than we were back in January. And obviously that's something that we are focusing on in our efforts to deploy 8 National Guard resources, get them trained up as CNAs. We'll talk about that in a minute. Let's look at the hospitalization graph from the beginning, going back to the spring of 2020, where we had 300 Delawareans hospitalized across our state. And then we got healthier through the spring and summer. And then about this time last year, again, reached another peak of 474 on January the 14th, 2021. And again, got a little bit better in the summer, a lot better in the middle of the summer, down to 14 that were hospitalized in late June of 2021. A little bit of an uptick there around Halloween and going into Thanksgiving, and then this run up with the December holidays, and now on New Year's with the new high of 602 hospitalized across our state. So one of the things that we know about those that are in the hospital is that consistently between 70 and 80% of those that are hospitalized with COVID-19 are unvaccinated or partially vaccinated. So really a simple solution to this problem, which is to have everybody get vaccinated to reduce the severity of the illness, to reduce the transmissivity of the virus, and also if you're only partially vaccinated, to get fully vaccinated and to get your booster shot. If we look at on the vaccination side, we continue to vaccinate Delawareans. We're up to 1.5, almost 1.6 million vaccines administered, over 624,000, which is 64% are fully vaccinated. And then you can see the numbers there at the bottom. Delawareans 5 years old and older, 68%, 12 years and older, 73%, 18 years and older, 75%, and then Delawareans 65 and older, those are most vulnerable, really. Fully vaccinated, these numbers are 93%. So I said when we look at the testing numbers, 1 in 4 positive. And so if you have COVID symptoms, you should assume that you have COVID, and you should make sure that you get tested or quarantine right away to make sure that you're not infecting other family members, coworkers. If you're sick, stay home. If you're sick, make sure that you're not coming in contact with others. Here's the experience in other states. On the next slide, you can see all the other states in the region: Pennsylvania, New Jersey, Maryland, New York, Washington, D.C., Connecticut, and Rhode Island. The dark orange line is the new cases, and that's the more dramatic spike up that we're seeing, again, across the region. The softer orange, lighter orange colored is hospitalization. That's the middle line. And then the grayish number is the number of deaths, which you can see it lags the other two significantly. But the hospitalization number is the one that's creating real problems here in our state. So our energies are focused on protecting hospital capacity. You're going to see from the next graph that we have people that are in the hospitals for lots of different reasons. And we're challenged, the hospitals are challenged in discharging their COVID patients once they recover to move into longer-term care and assisted facilities for lots of different reasons, primarily staffing reasons on the long-term care side, as their workers test positive or are close contacts of those that are tested positive and have to quarantine for some period of time. So every employer that we talk to, hospitals, long-term care facilities, healthcare organizations, and just the general business enterprises are challenged with worker shortages driven by the high number of COVID-19 cases and close contacts. Many of these cases are associated with private indoor parties and activities, and where you have other folks that are then have to be quarantined once one person in that group tests positive. So our focus is help the hospitals by providing resources, mostly staffing resources, to the acute care facilities, with the assurance that with adequate staffing, as approved by the Department of Public Health, hospitals will be able to discharge folks to their care. And so that's a priority as we look at our next slide, and we're going to hear more about this program from AJ Shaw, who talk about the efforts working with the National Guard. So we have 100 members of the Guard are in training now to become CNAs to do this work in the long-term care facilities so that their hospitals can decompress. Well, last two press conferences, we've had doctors and personnel, physicians that work in our hospital settings, and we've heard it from them that this is a preventable crisis. There is a way to protect the hospitals, and that's to make sure that more people get vaccinated, make sure that people wear masks when they're in public settings or in close proximity to others. The healthcare workers are really working hard. They are stressed by fighting COVID and the other patients that are in their facilities, as well as dealing with the stress around their own health and wellness. And so we need every Delawarean to be mindful and respectful of the challenges that are faced by our healthcare professionals and do what you can do to help protect them. And so we are, again, fighting the surge. On the next slide, we're almost 2 years into this, and so we know what we need to do, which is to wear a mask when you're indoors in public places, to get vaccinated if you're not, to get your second vaccination if you only have one, and get boosted if you have two vaccines. Get that booster shot and stay at home when you're sick. I know sometimes it's difficult to determine whether or not you're sick enough to have COVID, but when you're sick, you should stay home and don't take that chance. So thank you to our healthcare workers. We're going to work to ease their burden and do the things that we know that will work by wearing our masks, by keeping our distance, getting vaccinated and boosted when eligible. So real simple solution to this crisis, and that is, if you're not vaccinated, get vaccinated. If you're not fully vaccinated, get fully vaccinated and get your booster shot. Be careful when you're around others. Wear a mask in public places. Be mindful and respectful of workers in those businesses, because the only way those businesses can stay open is if they have workers to come to work and do those jobs. We, like every employer, we're experiencing similar challenges here in state government. We do have a mask mandate requiring folks to wear a mask and requiring folks to get vaccinated or to be tested on a weekly basis. So with that, Dr. Rattay, welcome back. Thank you for joining us again this week, and I know you have some important information to share.
Thank you so much, Governor. So usually I start with areas of concern, but all zip codes in our state are of concern at this point. And while we are seeing a significant proportion of the Delta variant still in our state, we are particularly concerned about the rapid level of spread likely caused by the Omicron variant in such a short amount of time. You've seen our record-breaking case numbers. And additionally, while the number of tests has increased, that percent of COVID tests that are positive doubled. So as the governor said, it's now at over 25%. The week before, it was just 12.2%. So that number has increased very rapidly. Knowing that people still likely gathered for New Year's Eve activities, we anticipate these numbers are going to get even higher in the coming weeks. And as the governor just said, and we've said since the beginning, hospitalizations really are one of the truest indicators of spread in our state. And even though it is a lagging indicator, it really is an important indicator. These numbers that the governor just went over around hospitalizations are currently very concerning to us, and we are certainly concerned that these numbers are going to increase even further. So collectively, we really do all need to do everything we can to prevent as much additional spread of these variants. So let me talk a little bit about the new isolation and quarantine guidance. I know Secretary McGarrick talked about this last week. I'm going to talk about this again with a little bit more specific focus on schools, since this is the week that many kids are returning face-to-face to school. So many people are now familiar with these new CDC isolation and quarantine guidelines that were issued last week. What again we're going to talk about today is how this includes children in schools and their families. And we have been working with the Department of Education since these guidelines rolled out last week to advise on how schools should handle the guidelines. The bottom line is right now they should use the same guidelines as the rest of the public. And what that means is for isolation, or for those who test positive, they should isolate for 5 days, regardless of vaccination status. Now, if you have no symptoms, including fever, and your overall symptoms are improving, you can end isolation after 5 days, as long as you or the individual wears a well-fitting mask for another 5 days in all the places where they are, which includes home, but out in public, at school, workplace, etc. Now, if an individual still has a fever at 5 days, they must continue to isolate until they don't have a fever for at least 24 hours without using any medications to reduce their fever. Well, let's talk about quarantine. So what if you've been exposed to a positive case? Quarantine is not required for those who are up to date with their COVID vaccination. In other words, if you have been vaccinated and boosted, or if you've been vaccinated and you're not yet eligible for your booster, maybe it's not enough time since you got your primary series, or maybe because of your age, you're not yet eligible for your booster. But if you are up to date with your vaccines, fully vaccinated plus boosted, you don't have to stay at home in quarantine, but you must wear a mask in all settings. Now, if you are not up to date on your vaccines, in other words, you are not fully vaccinated, or you're not vaccinated at all, or you're eligible for your booster and you have not received it yet, then you are required to quarantine at home for 5 days. Now, that's a change from 10 days before. So now it's 5 days. But then at that point, you should get a test to check for COVID, and also wear your mask for 5 days. Now, anybody who's a close contact who develops any symptoms during that 10-day window should immediately isolate at home and get tested if possible. So it's important that schools and families understands that the guidance for schools, and I think this is on the next slide, may change. CDC has informed us that they're still working on some updated guidance for isolation and quarantine that is school specific. So while we are moving forward with implementation of this new guidance, we're also aware that there could be some changes. But the bottom line is schools have been a very safe place for kids. We have seen little to no spread of COVID during the time of this pandemic. And really, we know that the universal mask wearing makes a big difference. So we're excited for kids to get back to school this week. But let's talk a little bit about masks in general. Omicron is extremely contagious. It is, I think that we're all witnessing that in real time, how incredibly contagious this infection is. And so it appears that it is in the air. It is an airborne infection. It's spread airborne. And therefore, we need to step up our mask wearing a little bit. Cloth masks can work, but they have to be multiple layers. Same with surgical masks. A lot of people use those surgical masks. But again, you have to make sure that they are multiple layers. And also, very importantly, you have to make sure that they fit snugly around the face. The best ones have like a wire over the nose so you can pinch it. So then it's going to fit more tightly around the nose and around the mouth. If there's any gaps at all, there's ways that you can adjust the straps. But it's really important that we're paying attention to these masks at this point, making sure that they're multi-layer, making sure that there's no gaps around the face. I am a fan of the KN95 mask. This is very similar to masks that healthcare providers use. We don't want to use the N95s as much as possible because it's still important we save them for healthcare workers. But the KN95 mask is readily available, and it is very comfortable for most people. It fits very nicely around the face, also readily available. But it is important to check and make sure that you're not getting a counterfeit mask. So you can check on, there's a number of websites right now where you can check and make sure that that the masks you're looking to get are legitimate. They're NIOSH or FDA approved. But just really important again to remember how much of a difference that masks can make. But at this time, because this is so contagious, keep an eye on, what type of mask you're using, please. All right, some exciting news on booster updates. FDA yesterday made some new approvals. They authorized several vaccine changes. And while we're waiting for CDC's ACIP committee to meet tomorrow and finalize the recommendations, we are excited to see some of the moves that FDA has made yesterday. So that includes boosters for kids between the ages of 12 to 15. And really, since anyone under the age 18 can only get Pfizer, we're really only talking about the Pfizer vaccine at this point. The FDA reviewed some real-world data from Israel, which included safety data from more than 6,300 individuals in this age range between 12 to 15 years who had received a booster dose. And showed no new safety concerns following the booster in this population. There were no new cases of myocarditis or pericarditis reported to date in these individuals, and a good immune response was seen. Additionally, FDA's actions yesterday reduced the amount of time for people who were fully vaccinated with Pfizer to receive a booster from 6 months to 5 months based on additional data. And this is really important with Omicron because it's so highly transmissible, and those who have gotten boosters are much better protected. So it's great to be able to get your protection sooner now. So 5 months rather than 6 months for Pfizer boosters. And lastly, the FDA authorized a third dose of the Pfizer vaccine for kids between the ages of 5 to 11 who are immunocompromised, such as those who've undergone solid organ transplantation or have been diagnosed with conditions that are considered to have an equivalent level of immunocompromise. For these individuals, the 2-dose primary series is likely not adequate, and these individuals may very well benefit from a third dose. Now, at this time, CDC does not believe that kids between the ages of 5 to 11 who are not immunocompromised need a third dose of Pfizer. But as always, we have to convey, and we certainly understand that frequently or that these guidelines can change. And when they change, we understand they cause confusion. But again, it's really important for everyone to recognize that the science is constantly changing and evolving, and the new data provides greater insight to improved recommendations. And this is especially important in light of Omicron, which is a very different strain than what we had seen before. So, the governor touched on all of these prevention points. I have to touch on them too, because they're so important, and I'm going to put a little bit of Omicron spin on many of these as well. So as the governor shared, the majority of those who are hospitalized right now are unvaccinated, and that has been the case, for quite a long time now. So those who have chosen to remain unvaccinated are really having a tremendous impact on our hospitals. And so if you are unvaccinated, I really want to encourage you to please talk with a credible resource. If you're a parent and your children are not yet vaccinated, again, please talk with your pediatrician about your concerns, and please be open to reconsidering your decision. If you're eligible for a second dose or a booster, please get it now. With the Omicron variant, that is necessary to protect you and those around you. And also, we are seeing widespread influenza now in our state. So if you have not received your flu shot, please know that flu is already causing strain on our hospitals. So please stop by your nearest pharmacy and get your flu shot, as well as these COVID shots if you are eligible for any additional shots right now. I already talked about masks. I know we're all tired of them, but please, when you are around others outside of your household, please wear a quality, well-fitting mask. They do make a difference, and especially with the Omicron variant so prevalent right now. And I know AJ is going to talk about testing. Testing is a great tool, but right now demand has outstripped the supply. So right now, we want to make sure that those who really need to get tested have access to the test, and especially those who have symptoms or those who have been exposed to someone with COVID, those who are at higher risk, who have symptoms, who may benefit from some of the medications that are available. We want to make sure that those folks have access to testing. So please don't use a test if you've been positive in the last 3 months, or if you've been vaccinated and boosted, unless you have symptoms. And please don't do repeat tests unless you're indicated. We're seeing a lot of people who don't believe they're positive tests, so they'll test, several times more. And really, that's a waste of tests that could be used for other people. All along, we've been saying stay home when you are sick, but the key difference now as compared to before is that even if you have mild symptoms of a cold, you need to consider that Omicron may very well be why you have those symptoms. If you feel like you have a cold or have any of the other traditional COVID symptoms, please treat yourself as a positive COVID case, isolate from others, and get tested as soon as you are able. And finally, while we all want to go back to living our lives, this is not the time for unnecessary social events. Please think about how much our hospitals and healthcare workers are struggling when you consider whether hosting a party, going to a dinner event, or even meeting with a small group of friends makes sense right now. This challenging time will pass, and hopefully it won't take too long. But in the meantime, I thank you for all thank you all for doing your part. So back to you, Governor.
Thank you very much, Dr. Rattay. And you know, that last recommendation request is a really important one, and that is to really think twice about having a social event, having the guys over to watch, have a beer and watch the football game, whatever the case may be. It's really not a good time to do it, because when you think about the fact that 25% of the people, over 25% of the people are getting tested or testing positive, you know that the prevalence is above where it's been at any other time. And so, and we can't, there's nothing we can do to control those private environments, and nor would you want us to. So it's really a time where all of us has to take our own individual responsibility to come together as a community to protect one another and to prevent the spread from going any further, and particularly out of respect for those hospital workers, frontline healthcare providers, our long-term care providers. Those employees have been stressed, been tested to the limit, and you can help. You can help by not creating opportunities for the virus to spread to others. AJ, I know you have an important update as well. Some of the actions that we're taking to engage the Guard. The Guard has been unbelievable over the last 2 years, I know, and talk to General Berry about it all the time. We're asking him once again to pitch in ways that they haven't before. AJ?
No, absolutely, sir. And Happy New Year, everybody. I don't think there's a Guard member that we've utilized, and it's been probably up to close to 500 right now over the course of the last 20 months, that ever thought they'd be in the trenches, for lack of a better word, for a 22-month pandemic. We still got a lot of a fight left to go. So I'll start to get going over just some of the previous updates. First, we'll talk about testing, where Dr. Tay left off. Yes, the demand for testing has increased. Would we love to have more tests and more access? Absolutely, but I think we also have a decent story to tell about our testing as well. So right here is a look back on the fourth quarter of 2021. We were averaging somewhere in the low 20s to mid 20,000 range, really through the fall, for just curative testing. So this is just the National Guard soldiers that are at the state facilities that are doing curative testing. This is the trailers we're doing. So these are really the state ran and managed testing sites. And then really over the month of December, doubled that, and actually over doubled that. In last week of the year, 53,000. Taking into account there's a few holidays as well. We're doing 10, 13,000 tests on any given day, depending on the weather and other impacts. We lost a day of testing yesterday. We understand that it was weather. We have staffing issues as well with our testing partners. It's going to take us a while to make up for that. However, we are committed. We will continue to have access to testing. We have a request in with our federal partners to do some community testing as well towards the middle of January, if that gets approved and finalized, which could bring us another 10 to 15,000 tests a week. School testing will start back up this week as well as schools go back. I know some delayed it yesterday because of the weather or other issues. Our partners there and Dr. Tay teams have been working with them throughout the holiday to ramp up staffing and be ready to test as soon as they walk through the doors. With that said, we have 50,000 curative. We have another 20, 25,000 minimum week that will be done in schools. We have the vault at home that we're still doing at the rate of thousands a day. Our testing capacity at a state is somewhere north of 60,000 a week easily. Doesn't include Walgreens, LabCorp, Quest, other tests that the hospitals are running. So the testing's out there, like the governor and like Dr. Ortiz said, we have to make sure it's out there for those people that need it, and we don't have people going on a Monday testing positive and going back Wednesday taking that spot in line because they want to see if it was a false positive or if they're clear yet for somebody that might have symptoms. So this is just kind of reiterate what we've been doing, how we've ramped up and prepared for this. But I think nobody anticipated the testing demand above any other time we've seen during the pandemic. Also with a large number of Delawareans vaccinated too. Next slide, please. So this goes over to the testing. Over the last year and plus, I'll say, we've been putting out weekly PDFs with the help of the communications team of where our testing sites are going to be for the week. We are going to hold back on that for the next several weeks between weather, staffing, which we're getting hit by as well with individuals being COVID positive, having to scale back some hours or testing. We're going to ask everybody to go to de.gov/get-tested. Use that as your, the source where hopefully the most updated information. We will make sure the state-run and managed sites are updated. There are a lot of private partners in there as well, and we've asked them to do the same to make sure they let us know when they have changes. We will keep that. That will be kind of the one place you could go. We don't want to be distributing a document that gets posted to social media or emailed out to tens of thousands of people on Monday, and then something changed because of a weather or staffing change. So please go to de.gov/get-tested for the most updated information. Next slide, we'll talk about what the governor talked about at the hospitals. We had one of our weekly calls this morning with the hospitals, talked to them on their operating officers about what is happening right now in the hospitals. Here's the graph we've showed you for months now. The blue line, the COVID positive, is getting bigger. That gray bar is getting a little bit bigger. And remember, you have to look at it over a few days. Hospitals are getting hit with, some of their staff out from COVID positive. Individuals are going to the hospitals to ask to get tested to be cleared without any symptoms, without any medical complaint. Those are the people we need to keep out of the hospital and let the emergency departments and their staff, concentrate on those that are injured and ill and need emergency medical attention. So with this, just, it's not improving overnight. We have a few things we're going to talk about that will slowly over time help take some of that pressure off of it. But as the governor said, it's a shared responsibility to make sure we're doing what we can to lower the risk and seeking out the right health resources when needed. Next slide, please. So again, like I said, the ER cannot be your first stop for a COVID test. If there's a long line somewhere else, if you need to get a test to get back to employment or back to school, we know there's a line at some of the community sites. We're working with our partners to increase that capacity as we speak. We're looking to have federal assets on the ground, hopefully within the next 10 to 14 days to, provide us another bit for the surge. However, those emergency rooms, they're bursting at the seams is what one of the hospitals used this morning at just making, they can't handle everybody's going through there. And some of the stuff does not need to be going to the emergency room to be treated for. We talked about the National Guard as well. 500, General Berry's force, about 2,500 men and women between the Air and Army National Guard. You think about 20% of those, over that probably has been on the ground in Delaware doing something for the COVID response, from food distribution to testing to PPE distribution. You name it, they've done it. They helped with the contact tracing when that launched in early 2020, and they continue to be there by our side to assist us. 100 individuals from across the state and region, because some of the men and women of the National Guard don't reside in Delaware, came to the National Guard headquarters yesterday. So they went through the 10, 11 inches of snow that we got down south to, I don't think the governor had enough to make a snowball up in Wilmington yesterday, but they came there to be put on orders to start this training. They will be doing an intensive training with Del Tech Community College over the next 14 days. Thank you to our Del Tech partners for really being creative with us and getting this done in an efficient and quick method. They will be certified as nursing assistants at the end of this tenure. So it works too. Maybe when their orders are done, these people could go back and work in one of these facilities as well as a full-time job. But they will then be assigned, and Dr. Ortiz team's working with the post-hospital, not always nursing homes, not assisted living. It could be a therapy session for somebody that just had, it might be going to a stroke center or another type of injury. So they're not all nursing homes. We want to make sure we're clear about that. We're sending them to facilities where we could open beds up to increase the capacity for the hospitals. We're hearing from the medical community that there are people staying in the hospitals days waiting to get a bed in some type of post-hospital setting to get the care they need because it's not opening up. Staffing is one of those components, and this program will help us bring it there. The last thing about this is we're looking to expand this as well. So the guards being used for the CNA program, we're looking to see where else can we help the healthcare system, the EDs, the long-term care facilities, really help relax individuals that have been stressed, and how can we work in that, whether it's delivering food, whether it's helping with the administrative duties. We're working with General Barry's team and some of the healthcare teams outside of the state to see what we could do to provide resources there. Still kind of working that right now, but doing a bunch of informational calls and stuff like that to see where they could go. So next slide, please. And then I'm going to turn it back to you, Governor, and talk about the vaccine.
Thank you very much, AJ. And the National Guard, men and women in the National Guard have really come up big over the last 2 years. No matter what we've asked them to do, they've been there on the job, whether it's testing, whether it's delivering foods, whether it's helping our schools. Of course, we have a snow emergency. You're right. We didn't have many snowballs up here in Wilmington, but we had a foot of snow, I'm told, in central Delaware and lower Delaware, and needed every one of our first responders out there to help, and our DelDOT personnel to clear the snow. And the only good news there is it kept people at home and maybe out from getting close to others that might be COVID-19 positive. But we need to thank our healthcare workers for the tremendous work that they do and have been doing over the last 2 years now, coming to work every day, knowing that they're going to face the stress of overburdened emergency rooms now and challenging patients, and even getting patients that are getting a little bit unruly. And please show respect to our healthcare workers, hospital workers, when you need their services. And we all, at some point in time, will need that. So we're going to use the National Guard. That's the main reason for our state of emergency declaration with this CNA program to help with our long-term care facilities so we can decompress the hospitals. We're also looking at other ways that they might help, including as our number one priority to keep children in schools. That is something we know that those spaces are safe spaces with mask wearing and with social distancing and with the discipline that comes with classrooms. I was in schools before the holidays myself, promoting our Wilmington Learning Collaborative Initiative, and just saw the students with their masks on and with the kind of protections that we're looking for in all of our facilities and gathering places. Obviously, state government, we have mask mandate and vaccination requirement or testing, weekly testing. We're testing, as AJ showed, at unprecedented levels. I think it was 53,000 there, just with the state curative sites, not including the private testing and the other testings, the rapid tests that are out there. And so that's a good thing, but just be careful. If you don't need a test, don't just go to get a test to be sure about your status when we have other people who are feeling sick and need to make sure that they're not passing the virus on to others. So with that, I know we have media that have joined us. We thank everybody for joining us this week. You can do something to help us out by getting vaccinated if you're not, getting your booster shot if you have it, wearing a mask when you're indoors in public places, keep social distancing, and really importantly, sometimes we let our guard down in our own homes and private places, and now is not the time to bring a bunch of neighbors over for a house party. It's just not going to help. So let's all pull together, do what we know we have to do, and get over this January surge. So we'll invite the press's questions. And
the first question is going to come from Meredith Newman from the News Journal.
Hi there. last year, there was a lot of talk about how herd immunity was an important goalpost to get out of this pandemic. I'm curious, at this point right now where we are, what are the goalposts to help us get out of this surge? And aside from asking people to take personal responsibility with vaccines and wearing a mask, what is the state doing to accomplish those goals?
Dr. Rattay, you want to comment on the herd immunity question?
Sure. Hi, Meredith. So herd immunity is a concept that we use a lot with infectious diseases, with vaccine preventable infectious diseases. And, oftentimes you're really looking at vaccination numbers at like 95% or above before you can really get an infection under control. I think that there's been no set solid number in which we're going to achieve herd immunity. And that's especially the case with this type of virus like COVID, where you're seeing a lot of mutations and different variants that have different characteristics, some more responsive to the vaccines or not. But what we do assume is that the more immunity that individuals have, whether it is from primary series, boosters, as well as natural infection, all of that is going to better protect individuals from future infections. So even if, for example, getting a natural infection only provides 30% protection against infection, or a vaccine gives you 50%, it still is providing some immune protection for yourself and helps prevent spread in the community. So I guess bottom line is that the more protection that we get, and the best protection is from vaccines, the better able we are to control the spread of the infection and also control future mutations that lead to more variants.
And so if you look at the data that we presented again today, I mean, we have pretty high vaccination rates, but the number one goal, as we continue to say, is to get those numbers up higher, to get to the kind of immunity that you're talking to. And in the meantime, to manage the effects. And that's where our fight to help the hospitals comes in. And people getting vaccinated helps with that as well. We know that 70 to 80% of the people that are hospitalized are the unvaccinated. And so when you get right down to it, that has to be the solution.
The next question will be from Roman Battaglia of Delaware Public Media.
Hi there, Governor. I have a couple of questions. The first one, we talked a little bit about schools, and I'm just wondering if you're concerned about school districts' operational capacity over the next few weeks with these COVID cases spiking. We've seen a couple of school districts, including Sussex, Appoquinimink, and Christina, close or not close, but go virtual because of what they call operational capacities. I think one of them cited school bus driver shortages. I'm just wondering if that's a concern.
Yes, it is. Absolutely. It's the number one concern. And it's the number one concern on our White House call this morning. There was comments from several governors about the new CDC guidance or anticipated guidance that Dr. Rattay talked about around quarantine and that type of thing. But every governor, regardless of what state, has at the top priority, and our federal partners, in keeping children in schools. We know that they need to be there for learning. We know they need to be there for social, emotional health issues. And we know they need to be there for the general operations of our economy. And so that's the objective, is to, but we know that they're safe. And so the question really gets to be operational, Roman, to your point. And every situation's different. Every school district is different in that respect. We are looking at, I mentioned it briefly, whether there's a role for the National Guard there to help, because it's essentially, as you said, a staffing problem. It's a problem with people, staff that have tested positive for an infection that they got outside of the school and not being able to come to school to teach or to drive a bus or whatever the case may be. So those are operational concerns that only districts and individual schools can determine, and decisions that they'll have to make at that level. We, however, are providing them with the tools to manage whatever they experience in their individual communities. And we know that the vaccination rates are very different across the state in community by community, and therefore district by district and school by school.
And my other question is about hospitals. I know that we're breaking records in terms of hospitalizations here in Delaware, and at least from what I've been reading nationally, Delaware is experiencing some of the highest strain on hospitals in the country. And I know we've been talking about the National Guard coming in to help with this stuff. I'm just wondering, at what point do more drastic measures need to be taken to ensure that hospitals have enough capacity to take care of all of these patients?
Yeah, that's a really good question. It's as much a question for the hospitals, and maybe AJ can help with some of the thoughts that came from the hospital call this morning. But what I would say is immediately what the hospitals have asked us for is exactly what we're providing, which is resources to help them decompress, meaning move patients out who don't belong in the hospital so that they can be in a more appropriate setting. Those settings are stressed with not having workers to provide whatever care that is at that level. And so we are engaging in this training process of 100 National Guard men and women to fill that role so that we can move those patients that don't need to be in the hospital into these other settings. AJ, you want to comment on that?
Yeah, so I think I'll go back and just kind of explain, the way the response to the hospitals was designed and what we're dealt with today. So, and how the federal support and state support comes in behind it. So hospitals always have surge plans, and those surge plans, and we learned more about that in the last 2 years, I think anybody ever wished, was how do we get more patients treated in the hospital? And we talked to the hospitals about this 20 months ago about like, hey, what's your capacity? What could you do? And, they say, hey, we have plans where we could use this part of the hospital that we usually don't use for patients, so we could have beds there. What's the common denominator that they need staffing? The thought is if there's a catastrophic incident, you're able to go outside the area, pull in those resources from around the country and the world. We saw it when we sent resources to Puerto Rico. We saw it in 9/11 where everybody sent medical providers up to New York City and down to the Pentagon. So you kind of do that surge of pushing resources out, and you push them to local communities. Well, the problem is now the whole country and the whole world's in the same situation on the spike, and it changes the dynamic. So we don't need the space. It's not brick and mortar facilities. We don't need to go build something or add an addition on it. We need the bodies, and we need capable, trained, licensed bodies. We have relaxed licensing requirements through public health orders that Dr. Atay and I issue to allow retired individuals that may not be licensed in Delaware but that are licensed in another state to come help in the state of Delaware. And what we're hearing from the hospitals today is, they're seeing the same staffing issues that everybody else is. You go in a restaurant today, you might have to wait for a table, and it's not because they're all taken. It's because they don't have enough people to work the tables. And that's what the hospitals are doing right now. We know we could request some resources from the federal partners. We've talked to the hospitals about that as recently as this morning. There's not many resources at the federal level to come in and save the day. So that's why we're looking at what can we do with the National Guard here in Delaware, between training and thinking outside the box and assigning them to maybe non-traditional missions to help relax the hospitals a little bit. So the foundation here is staff, and it's not just at the hospitals, it's at the walk-in clinics, it's at doctors' offices and other places. So I know that's a long story to your question, but we don't have that backstop that we would if this was a Delaware or regional specific incident.
The next question is going to come from Cody Decker from WRDE.
Thank you. Governor, I hate to veer away from the COVID conversation, but I do have a curious question regarding the storm yesterday with the snow. I know New Jersey activated the snow emergency. I know Delaware doesn't do this. Can you just kind of explain why that is? And if you have anything to add on the response from yesterday or what you heard or, what your thoughts on the response were? Sussex, I know we were hit pretty hard down here.
Yeah, I'm going to defer to AJ, who runs those operations. But essentially, we have a group that meets in advance of a storm hitting the state. They monitor the progress of the storm. They anticipate what we might see in terms of accumulation of snow, ice, whatever it might be, hurricane, tornadoes. Try to put in place resources to respond. And one of the more difficult decisions is whether or not to close businesses down. And a lot of most often those decisions are based on operational needs, time of day that the storm might come, and transportation needs. The Department of Transportation is really kind of front and center there. And so a decision was made relatively early, particularly coming out of the Christmas, New Year's holiday, where I think some schools were in, other schools weren't, was just to defer to caution with a statewide look when, as it turned out, the real bulk of the storm, the accumulation of snow was in central Delaware and lower Delaware. So that's kind of a high level kind of description of how we look at this thing, but it's a very experienced and sophisticated team that AJ heads up, and AJ can explain more about that and about this particular event.
No, so I kind of think everybody was a little bit in awe with what happened yesterday. This was a late forecasted storm. I think there was one or two models that towards the end of last week kind of cautioned a few meteorologists, but it really wasn't until I will say Saturday night to Sunday morning when the models were coming out, and even at that time, the products we were getting from the National Weather Service did not have high confidence in where the snow was going to be, how much snow could be the potential, and if there either be any snow. So with that, like the governor said, we pulled together our key partners. DelDOT, really, bears the brunt of these types of situations. We're here just to provide backup and support if needed. But it was a fast-moving storm. As early as Sunday night to yesterday morning, where that snow line was going to be and how much it was going to be changed. For us to do what we can do here under state of emergency is do road restrictions or driving restrictions based on type of employer, use, etc. So we have a 3-waiver system. One's with the is just a warning. Second is for essential personnel. Third is nobody's on the road with the exception of public safety partners. To do that, once the snow falls, when people are already out of their house and at home, is counterproductive. So, it was a lot of coordination between the county, specifically Sussex County and DelDOT yesterday. We know there was whiteout conditions, and it was even, if you drill down to Sussex, is a smaller portion of Sussex as well. It was a band that came through kind of from the southwest to the southeast. Some of the beach area had 3 inches. And then you get up to the northwest part of the county, and they're down in the 4 or 5 inches. So it was isolated. DelDOT relocated snow plows and crews from up north down south as soon as they feasibly could to make sure there wasn't going to be residual issues there. The snow emergencies, we would call driving restrictions here, anticipating them in advance is what we try to do, as well as utilizing the guard if we need to. I will tell you, usually when we get up to that foot level is what we would start talking to our county partners at. Do we need National Guard vehicles to respond from a public safety aspect to assist our fire, police, and EMS partners? Absolutely, that foot's about it. But this system came in here so fast. Starts snow in the morning. It was out of here by sunset. We did the delay today in Sussex and Kent County to give DelDOT crews a little bit more open road and time to work. Like I said, I know they sent crews down from Newcastle County. So, late forecasted storm. A lot of uncertainty in the forecast from the best meteorologists in the business, and I think we'll learn from it. However, we are happy to say we don't have the same situation that they had in Virginia, where they have people stuck on 95 now going on 24 hours.
Looks like I cut Meredith Newman off before she had a chance to answer ask all of her questions. So we're going to go back to Meredith from the News Journal.
Sorry about that, Meredith.
Not a problem. I won't take offense. I just wanted to follow up on AG, what you were talking about with the federal partnership. I know you've already kind of talked about testing, but it's just looking like if someone wanted to get tested this week in Newcastle County, it's basically impossible to do so. Can you just follow up on the federal partnership and the possibility of other mass testing events?
Yeah, so two things. So yes, there are probably very few appointments available at some of the testing sites. However, those testing sites still accept walk-ups. And we've worked over the last probably 3 weeks with Curative as the numbers are ramped up to make sure, hey, let's try and get those with appointments to the front of the line, get them in and out as quickly as possible, still accept as many walk-ups as possible. And usually we say about 2 hours or 3 hours before a site would close. It could be 6 or 7, depending on what site it is. We might at that time say, hey, we can't take any more. I'll give you a great example. We had one of the Curative trailers up in Newark, I believe it was last Wednesday or Thursday, did 1,800 tests. Of those 1,800, probably half were registered. The other half were done walk-ups. We had a trailer down in, I believe, Western Sussex County. They did about 900 people. So that we're trying to geographically meet demand as well as account for walk-ups as well. So just because they get an appointment doesn't mean we're not going to test them. We just don't want to be putting 1,500 appointments out there and still getting 500 walk-ups. We have to kind of draw that line in the sand somewhere. So patience is necessary, triaging. If you have symptoms, if you have to get tested, a mandated test reason from a doctor, they're the people we want to make sure have access to it as well. The federal thing, so we put in a request through FEMA for HHS, this was last week, probably right before the new year, to help us really with some surge capacity for testing, and they've done it in other regions as well. So we're looking to have a stand-up site. We're still deciding locations and whether what the model is going to be, but one in each county for up to 2 to 3 weeks. Starting mid-January, and they'll be mostly federally managed. So they'll bring in a lot of the staffing. They will use their lab partner, so it will not take away from the capacity we have at other locations. It will be incremental capacity, and then the state and Dr. Tay's team helps with some of the messaging. We'll utilize our partners for traffic control. All those wraparound services that we might need that we would have a better hold of than our federal partners. So still, we know we're going to get some assistance. Where, when, how much is meetings that are ongoing today, tomorrow, and Thursday to kind of dot the I's and cross the T's.
It's also important to point out, and you alluded to it, AJ, which is that we have thousands of people with appointments that are getting tested. In fact, you're going to test, I don't know, in a given day, 10,000+ people. Now that's statewide, and people that have access beyond our resources to self-tests with Vault and with antigen tests. And when you think about and do the math around the percentage of the population that it's vaccinated, you're talking about, only maybe a little bit more, say 30%, maybe not even that number who are not vaccinated. It doesn't mean they may not have to get tested, but we know that 71% of those who are hospitalized are people that are vaccinated. And so those testing numbers, weekly testing numbers, are off the charts right now, and the availability obviously are stressed because of the surge that we're seeing. And some of that is people that actually 25% right now, 26% of those test positive for COVID. Others maybe have just been exposed to somebody with COVID, or maybe they are having flu-like symptoms, which is the flu, and not COVID. And so that all comes into it, which is why the demand is so high, but it is a significant number. Going back towards the beginning, Meredith, I think CDC told us we needed to do 80,000 tests a month. And we did 53,000, 54,000 in a week. And that didn't include the other sources of testing. And so we've blown right through the 80,000. And is that enough? It's not, but if we test more, the results are going to take longer to get back, and then you end up with that dilemma as well. So it's a really challenging thing, but we have really ramped that up to a level that's far beyond what CDC was originally recommending.
Our next question is going to come from Tim Mastro from the Delaware State News.
Hi, all. Good afternoon and Happy New Year.
Happy New Year, Tim.
Thank you. I wanted to follow up on hospitalizations. I know we talked about capacity, and the Delaware National Guard will help with that. Just from talking to hospital leaders, they have said if someone needs care, they'll find a way to give them that care no matter where they are. But is there a number where you really do not want to cross? How many hospitals right now are operating at or even over capacity?
Yeah, I certainly don't have the knowledge or information to respond to that question. You're better off asking them, although AJ, I don't know, given your participation on a weekly basis with the hospital administrators, whether you have a sense. AJ talked earlier about the different ways that they can manage their census in the hospital and treat patients in different ways, but we certainly don't want to get into a surge situation as we are now, where people are waiting for rooms, people are waiting in the emergency rooms, and that type of thing. But that's really a question for the hospitals. AJ, any thoughts on that?
No, I think, like you said, it's a good question for the hospitals. They do have a can-do attitude, which is, what we need. And I think the only thing that is different from years past, when they, because I think Dr. Ortega talked about how, hey, they can easily be over census during a bad flu season, but, usually you don't get your staff hit with 30% positivity rates that the hospitals could easily be seeing now. And then those workers are out for, a week or so, and then others go out. So again, the staffing situation is so dynamic that we have to get it under control, because we can only deal with this stress for so long before stuff starts to crumble.
Next, we're going to move on to some pre-submitted questions. We have 3 questions that were submitted before the briefing. The first is going to come from Chris Barish from WHYY. And Dr. Tay, this may be a question for you. How many children are currently in the hospital, and how does this rank historically since the pandemic began?
Thanks, Emily, for that question. I don't have the exact numbers of pediatric admissions in the hospitals. I would suggest that AI DuPont Hospital for Children will have the best numbers. What I can tell you is, we are hearing that their numbers of COVID positive admitted patients are higher now than they are before. We're also hearing, though, that they do not have the capacity issues to the same extent that the mostly adult serving hospitals in our state have. So there's more capacity left still there in our children's hospital in comparison to the stress and strain that we are seeing on our adult hospitals.
Thanks, Dr. Tay. The next question is going to come from Katie Tabling, and this is for the governor and AJ. Do you both foresee a need to use field hospitals like you were prepared to do in the spring of 2020?
Yeah, I'll hand it over to AJ. We've talked about that, but I think AJ kind of answered it in one of the earlier questions, that it's not really a facilities problem, it's a staffing problem. AJ?
No, and I think that's the answer. And I think we did talk to, or we know the Healthcare Association talked to Nemours. Nemours is, hey, use our area again. We could fit 30 to 60 patients in there. A problem is the state was allocating a good number of nurses and medics from the Guard that are already on other missions right now, doing other stuff. So if the facilities have a way to utilize that space, that's great to offload patients there. But the ability for us to come in and provide, a third to half of those licensed, healthcare workers, we're not in the same position we were back in the spring of 2020 with other missions and other requirements going on right now. So it's a conversation we have multiple times a week at the hospitals to see where we can relax. But building something right now, setting up something new, still needs healthcare workers and licensed physicians to run it, and that's what we don't have.
Yeah, so just to underscore that point, these are the National Guard's people that we're training now are CNAs that can augment staffing at existing facility. But to stand up a new one, to AJ's point, you need physicians and others. We have those assets, but they're already doing their regular job, and we don't want to pull them off the regular jobs to come in here, because then they would be leaving whatever facility they're currently working in their day job, so to speak.
The last pre-submitted question comes from George Shea. He said he's concerned about the violence and aggression that he's hearing about at testing sites and other healthcare facilities. So he's curious, what are we doing to provide protection to the many volunteers and workers at these testing and vaccination sites?
AJ, any thoughts on that one?
Yeah, no, I think we're concerned with it as well, because it's an emotional time. People are stressed, and I think it's our job to try and bring some calmness to the chaos. However, as we go into what we're doing, we also know there was a private partner that was conducting testing in Sussex County, and they withdrew their, that they do other medical stuff as well. They stopped doing testing because their staff was getting, verbally, assaulted, if you want to put it that way. We do work with the local law enforcement and Delaware State Police, so they know where the testing and vaccination sites are, and kind of provide that situational awareness, and as well as if something happens, we will shut down something to reset and be safe. So we know emotions high in these workers, the ones, whether it's Curator, whether it's Dr. Tay's team and the secretary's team at the public health clinics, or those partners that do it privately. They've been at this a long time, and they understand everybody's frustration and their anxiety right now. But like the governor started with, it's a shared responsibility amongst everybody. We have to understand that everybody wants to get tested. Everybody needs, has that desire, but we need to have patience, and we need to be civil to each other as well.
All right, that was the last pre-submitted question.
And thank you to the media for joining us. Thank you to other Delawareans who've been following along with us. We appreciate your attention. We appreciate your vigilance. We've got a dire situation across our state with this spike that we anticipated in COVID-19. The cases that we're experiencing after the Christmas and New Year holiday, particularly at a time where with vaccinations, people are feeling that they don't have to be careful, they don't have to wear a mask. But we know that obviously the private parties have occurred. We know that people have been exposed. We're seeing highest number of cases that we've seen in the last 2 years, and 1 in 4 of the tests are positive. So there's a tremendous amount of virus spreading in the community. And so the way to stop it is to wear a mask, keep your social distancing, don't have your house party, avoid the protections that, or take the protections that we've been talking about now for 2 years, and for the future, for the next, after this period of time, if you're not vaccinated, get vaccinated. Obviously, that's not going to help now if you've been exposed in a house party on New Year's Eve. But it will help us as we move through the month of January into February, where people are still going to be indoors. We need to get more people vaccinated and fully vaccinated and boosted. And in the meantime, as the spread occurs, people need to take individual responsibility and wear your mask when you're in the stores, indoors, when you're in close contact with others, particularly in indoor spaces. And that way you can prevent the spread, you can protect hospital capacity, and help the hospital workers and other frontline employees that are out there daily. So I want to again thank Dr. Rattay and her team at Public Health, AJ, and the folks at DEMA, particularly now fighting the last 24 hours or more, the first, I guess, winter storm in addition to COVID. We've got a couple of tough weeks ahead of us, hopefully, and if we can pull together, everybody take individual responsibility and avoid large crowds, wear your mask indoors, and make sure that those that are in your household do the same. Don't schedule that party for the college playoffs or the Super Bowl, and get your vaccine. Thanks for joining us today.